recording now. Hi, so I'm here with Ryan Pryor to discuss an article he and Fiona Lowenstein wrote together for The Nation about long COVID. And so, Ryan, I guess first thing, what was sort of the overall genesis of the article? I mean, what was it that you felt you needed to kind of say in The Nation?
Yeah, and thank you so much for having me. Fiona and I wrote a piece that came out in early April, and we had been working on this since all the way back in October. Yeah, we both had books coming out in November, so our original objective was to co-promote. Fiona's book was coming out. Long COVID Survival Guide was November 7th, and then or November 8th. And my book was coming out, The Long Haul was coming out November 18th or November 15th.
Sure.
So we were writing this piece in October, hoping to land it in November. And so
Capitalize on the book's publications.
yeah, it was originally, it's been many months in the making. I think that ultimately, what came out, I think was quite a bit better than what we originally proposed. We had originally pitched a shorter op-ed type piece, and then the Nation ultimately, not just published a long form piece in online, but it published it in print also. So we were happy with the way that it ended up blossoming out. But the original idea was to talk about this Millions Missing protest that happened right outside the White House
Mhm.
for long COVID and for MECFS. That was in mid-September, and one of the things that happened.
And was it a joint ME, CFS and long COVID event?
Yeah, and we were in then so Emmy Action had spearheaded it, but yeah, we were joined by some members of the Patient-Led Research Collaborative. Lisa McCorkle and Hannah Davis and Gina Ossoff were a few of the but a bunch of long haulers were there too. So yeah, totally a joint protest. And it happened one day after President Biden had said on 60 Minutes that the pandemic was over, and that was a soundbite that kind of went viral
Mhm.
right on the night before the protest, and so we knew that that helped get the protest picked up in the New York Times and Time Magazine in conjunction with that quote from Biden. And there's going to be another Millions Missing protest on May 12th, which coincidentally happens the day after the president's emergency order for COVID is set to end. So I think there'll be a similar news peg
Okay.
there.
So that was the original thrust of the article, and then as it came out, how did it develop?
Yeah, we wanted to delve into the way that the long COVID movement and it was a people powered movement around uh, raising awareness about the disease, but then raising awareness about the needs that people had, especially the economic needs that for people who are disabled or who didn't have income because of this mass disabling event that public health authorities had not properly warned people about the long-term effects of COVID. And so that was the original genesis of the idea was to highlight the voices of long haulers. And as all of that was happening, you know, plenty of well, I'll say like eminent type voices. The editor of the Journal of the American Medical Association was also calling for a similar sort of like compensation fund for long haulers. And then a think tank, the Center for Economic Policy Research, was calling for this new institute for researching complex chronic conditions. So
The
a
idea is
lot
a new institute at the NIH.
a new institute at the NIH, or either a new institute at NIH or a new office that would be totally dedicated to complex chronic diseases like ME/CFS and long COVID and Lyme, or you could also call it infection-associated chronic diseases.
Mhm.
But a lot of these diseases that have a similar starting point with an infectious trigger, POTS, mast cell activation syndrome, Ehlers-Danlos syndrome. A lot of these should be all grouped together within one entity at NIH. But this is my argument, and it's also much of the patient sort of advocate movement, I think, agrees with some version of this approach.
So just one thought about the term. You mentioned the term long COVID is also a political term now.
Mhm.
So I wanted to ask you what you mean by that, but also another question. I mean, one of the things about long COVID, it's very non-specific in a way, so it's hard. I mean, is its usefulness as a kind of as a a patient-led term and as a kind of a political kind of rallying cry. I mean, it's hard to research sort of long COVID per se, because as we know, when you use the most expansive criteria, as we've seen in some recent publications, you end up with sort of basically everybody having something, which is sort of what some of the people who sort of are dismissive of the construct say, well, look, everybody has these symptoms, and then we do studies where everybody who's not in the, there's all sorts of problems with all these studies, but I guess just as a term, it's hard to study long COVID per se. You need to break it up into sort of subcategories, I would guess. So
Mhm.
could you just discuss both the political usefulness
Yeah.
of it, but also the the issues around it as a sort of a term encompassing possibly being defined in such a loose way that it encompasses everybody or very many people.
Yeah, and the word long COVID comes from an Italian archaeologist, Elisa Perigo, who coined that term early in the pandemic, and that was a hashtag on Twitter that it has blossomed up into being like the term that
Everybody, yeah, that
pretty
everybody.
much everybody uses. But what it really means is that someone got COVID and then developed long-term consequences from it, and those could be obvious in terms of organ damage or in terms of post ICU syndrome. But the broad gamut of what's happening in long COVID stems from these mild cases of people who, and I always have to be careful when I qualify the word mild, because it's mild means it could be very, very
Mild
bad,
means
but it's not quite
non-hospitalized.
hospitalized.
I think we use
Yeah,
mild often in this context to mean non-hospitalized, but it is sort of a misnomer
yeah.
because for many people these were not mild cases
They
at
were
home.
incredibly sick, but just we're told by, they called the ER, and said that, that especially early on, that, the hospitals were too full and it was not safe to go, and all that. So, yeah, so there's organ damage, PICS, which is ICU syndrome, and then, probably 90+% of it is this dysautonomia. And dysautonomia encompasses several different syndromes, which could be POTS or mast cell activation syndrome or myalgic encephalomyelitis. And some of these things are more silent organ damage that won't be fully seen for years to come. So different parts of the long COVID patient movement identify with different versions of what diagnosis they have. But and then one of the reasons why long COVID is the word long COVID and the word long haul are really important is because they directly align with the disability justice movement. And so there's social justice movements that act in solidarity that have a lot of the same sets of ideas. And
How
into
do you mean those terms align with the disability rights movement?
the disability rights movement to the one basic idea is that the there's a similar sets of mass disabling events from post polio syndrome back in the 1950s, and then obviously HIV AIDS in the 80s and 90s. So that there's people power movements of particularly marginalized communities who rise up in the wake of a public health disaster to demand that the system change in one way or another. And so I think the long COVID movement seeks to acknowledge and learn from and channel a lot of that same energy to shake up the system. And in this case, bringing chronic illness sufferers into this bigger tent coalition for disability. Those are some of what's happening with the long COVID as a political term. So there's so many different nuances scientifically about what's happening at the molecular level or the cellular level. And so when you see some doctors will write op-eds pushing back on the concept of long COVID, And one of the things they're picking at is that long COVID is may not be like a discrete disease unto itself, but
Right.
which is
Multiple.
accurate, because it may be, I mean, CFS, it may be, it could be 10 different things going on. So it's useful scientifically to parse it out. It's useful politically to unify around a coalition.
Right. Okay. What do you see? I mean, there's been, a lot of kind of high profile focus on psychosocial stress and sort of other related constructs, um, as sort of putatively being the cause of the symptoms that people are reporting. Um, and that seems to be a perpetual, or a persistent strain. So I mean, how do you see the arguments against that stacking up, and how do you see the do you see the sort of balance between that moving in one direction or another, the balance between that? Do you see that, where do you see the argumentation moving in that sort of dispute?
Yeah, it's sometimes I feel like there's, well, the overall, there's an overall camp that has argued this for decades, and then just certainly see it crop up in several high profile magazine pieces, which were published in Slate, and then the New
That's
Republic.
in New Republic and New York. Oh, and Slate, I guess, also more recently. Yeah.
And
From
so and sometimes those journalists write those arguments for certain reasons, but they're generally operating in alignment with this psychosocial camp, and um, a lot of those arguments just ignore the molecular biology that explains that this is a
Well, I think they also take sort of what seem to be the maximal kind of estimates, or they take, sort of studies that are poorly designed and that come up with really massive estimates that are the estimates, just as they are. If you think of post-viral syndromes generally, 5 to 10 to 15%, something in that order, sometimes more, sometimes less, but not, not everybody who, most people recover. And so some of the articles seem to be sort of suggesting maximal estimates, and then suggesting the maximal estimates aren't accurate, which is sort of true,
yeah,
but
exactly, yeah, yep.
it doesn't mean that the 15 or 20% or whatever percent, significant smaller percentage, is seriously ill. I mean, I think that's where some of the confusion comes in, if you know what I mean.
Exactly. Yeah. And so using some ballpark numbers, if you were to take a more conservative estimate and say that 10% of the people who get long COVID, or who get COVID get long COVID, and we can parse out, where that 10% number comes from, but then
And just as we're not saying it's 10% exactly, but we're saying somewhere in that range, which is comparable to what studies of other infectious related post acute infection related conditions are. It falls within that kind of range. It's not 1%, it's not 50%.
and it may just mean, it can mean that the person got one or more new symptoms that lasted for a few months, and that doesn't mean that they're now like disabled and can't work, but so that there's certainly a gradation in a spectrum. But if you take some studies will say that about half of the people who identify as having long COVID fit the diagnostic criteria for ME/CFS. And if those people who do fit the diagnostic criteria for ME/CFS within a few months of having long COVID, if they rest and then pace and manage those symptoms, like they may be able to have a more, maybe not a full recovery, but
Better recovery.
decent recovery. So but you see these arguments that say that these op-eds in the Wall Street Journal or something will say like long COVID is way overblown, but it's kind of it's a weak argument.
Yeah, I mean, I think yeah, if you're coming from the idea that you're expecting, 3/4 of the people with COVID to have had long COVID, then yeah, that's going to be an overblown estimate, but that's not what people are talking about. So what is the final thing that you want people to come away from the article with?
I really was impressed with the headline that they put it, which was the very end, which Fiona and I didn't write, but it says the long COVID revolution, and I think
Just let some of our readers know that usually in magazines, newspapers in the US, I don't know, other, whatever, the journalist is not writing the headlines, the editor or the copy desk is writing the headline. So we often see a headline and we're surprised about what it is. So that's why you could be surprised at the headline on your article.
yeah, no, it's funny, which is like the main thing that literally everybody else sees that first, and I saw it last, and but the concept of the long COVID revolution really does envelop the entire thesis of the article, that this is is injecting new energy into the disability rights movement. It's a mass disabling event for millions or tens of millions of people who have long COVID, and it demands strong solutions from policymakers across the government, across the U.S. government, across any national government. But when you approach these types of diseases with a disability lens, you can use long COVID as a reference point or as inspiration for doing a lot of things that the disability community has been asking for.
So basically, I guess it seems, I mean, I do think at the end of the article, you try to tie this together into sort of, it's not just, you're not advocating just dealing with long COVID, that you see sort of the lapses in the long COVID response as part of larger systemic issues related to people with chronic illness or chronic disabilities.
Mhm. Yeah, and there's this concept of disabled poverty, that because when you become disabled, you're vulnerable to falling through the cracks in the social safety net, because Social Security, supplemental income, for instance, a bunch of different programs are designed in ways that are deliberately denying people, keeping them off the rolls, even though they are disabled.
Right. And the same, I mean, the reverse effect too. If you're already disadvantaged, you're more likely possibly to become disabled because you don't have the support to rest and to do all the things that you need to try to prevent yourself from being fully disabled or from getting the cure you need.
Yeah, and just to put a finer point on it, when sometimes people ask me, what's the secret? How did you get better? How did you recover? Like, how can I do the same thing? And there's been times when I would just, not to be too kind of quick about it, but I was like, white privilege, like, because of coming from a white straight white male background with two parents who have master's degrees and have financial bandwidth to take care of me if I got sick. That enables me to
That
have a
makes a
much
difference.
less
That makes a
recovery.
difference. Okay, listen, thanks, Ryan. I really appreciate it. And I'll talk to you soon. Hold
Yeah,
on.
thank you.
Okay.